For those of us living in cities and suburbs, access to healthcare is easy to take for granted, as it's often just down the street. But in rural areas, the nearest clinic may be an hour away. Too often, that distance means people delay or skip care, allowing small treatable issues to snowball into serious health problems. A simple cough can become pneumonia, high blood pressure can develop into heart disease, and stress can spiral into a mental health crisis. Lack of access creates a domino effect that impacts not just individuals, but entire families and communities.
We're in north-central Pennsylvania. It's a very beautiful part of the state, but also a very rural part of the state. There are long geographic distances between towns, backcountry roads, makes accessing care difficult. And when accessing care is difficult, it can lead families to delay or forgo care, making their health problems worse. That's why community health centers are so important to rural areas. We meet patients where they are. We offer primary care, behavioral health, and dental health services, sometimes all at the same location.
Closing the gap to access are community health centers, essential lifelines to care, especially in rural regions like north-central Pennsylvania. A lifelong resident of the area, Megan Wells knows firsthand the profound impact of having a community health center close to home.
My mom was on disability. My dad was a second shift machinist in a factory, so he wasn't around much during the week. When my parents were at home, a lot of the home elements were influenced by domestic violence and addiction. So my sisters and I, we spent different periods of our childhood responsible for ourselves. Laurel Health having a site in tiny little Oakland, population of 2,000 or fewer, mattered to me a lot. There were times as a preteen, I was calling and scheduling my own appointments, and if it weren't right there, I wouldn't have made it.
Patients can come here for routine health care, for chronic disease management, or their walk-in needs, but also for services that go beyond traditional primary care. We have services like women's health, chiropractic care, behavioral health, dental care, and even speech-language pathology. And we can also help connect patients to community resources as well. Ultimately, our goal is for patients to feel like this is their medical home, where their health and their well-being are being cared for in a holistic way or in a comprehensive way.
Community health centers, as their purpose is intended, is to really make sure that all patients have access to high-quality, low-cost care. It's really a fundamental cornerstone of the care delivery model to ensure that patients in the most remote settings of rural communities or even urban settings have close access to health centers, and they can get there with convenience without having really to worry about barriers to care, regardless of their ability to pay.
Community health centers meet patients where they are, offering care, compassion, and support when and where it's needed the most.
Laurel Health has served the community for over 50 years, building trusted relationships with generations of families. We try to locate our centers in towns and places where people live, work, and play, making access to healthcare easier. We also offer mobile services and school-based services to meet the patients where they are. We love living rurally, but we want to make sure that all our friends and neighbors have the same access to care that they would in a more populated area.
Laurel Health takes a collaborative approach, leveraging the strength of its entire team to deliver more services and better patient experiences closer to home.
Our strategy is really team-based. Patients have access to physicians, physician assistants like myself, nurse practitioners, behavioral health specialists, nurses, and other support staff, and we all work together. Patients can schedule appointments or they can come in for same-day appointments. So if something urgent comes up, we can take care of you. And if there's something we can't provide directly, like a specialty service, we're going to make sure patients get referred to the right place and help coordinate that process so they don't feel like they're navigating it alone.
A lot of families have a hard time getting their children to different appointments. A lot of families have a hard time even getting their children to school. So if they can get them to school, let's take the services there. The schools are incredible partners for the school-based counseling. We've also had actual medical providers out in the school to provide some medical care and exams to the students. We've also expanded the dental program to do the same thing. That's the kind of thing that in a rural setting, you really have to do to be able to meet community needs.
Our mission is to improve the health and well-being of the communities we serve by offering world-class care in a compassionate, patient-centered environment. The patient is at the center of everything we do. Every decision that we make as a corporation is with that patient in mind. How can we improve access? How can we improve care? How can we improve services to allow you to improve your health and well-being? It's the cornerstone of what we stand for, and it's why we get up every day.
Laurel Health delivers care you can count on. To learn more and find a location near you, call or visit us online today.